Good afternoon and welcome to the USTDA Access Africa workshop on technologies to support healthcare systems in Africa. My name is Akego Koye and I'll be your moderator for today's session. According to the United Nations, by 2050, a quarter of the world's population will be African. It's important that while we discuss job creation, we also talk about health infrastructure required to support this growing population. Currently, Africa has only 1% of global health expenditure and 3% of the world's healthcare workers. There is a huge gap in the healthcare system in Africa, and technology is critical in closing that gap. Today, we will discuss how new and existing technology is being deployed to improve access to and delivery of healthcare in Africa. The speakers will also share lessons learned and what we can look forward to in the future. Joining me for the conversation today are Anstice Angu, Head of Health System Delivery at the Tony Blair Institute, Eyong Ebai, General Manager, Sub-Saharan Africa at GE Healthcare, Mwai Ngibwini, Group Head of Strategy and Business Development at Dawa Limited, Penny Lee, Global Vice President, Pandemic Response Systems at Oracle Corporation, and last but not least, Roslyn Doctor, Director, Middle East and Africa, and the Director of Global Technology Policy, Government and Regulatory Affairs at IBM. Before we dive into the conversation, I'm going to give my panelists 1 or 2 minutes to make brief introductory remarks. Anstice, can we start with you, please?
Thanks, and what a privilege to kick off today's session. Well, the institute where I work supports leaders, and so I'm really interested in coming at the discussion today with how do we help leaders to really shorten the learning curve, and how did digital technologies really speed up what is already going on in terms of healthcare delivery, and in particular thinking about how has COVID given us a window of opportunity to do things faster and to do things differently. Digitization of healthcare was going on long before COVID, but we've seen a lot of examples where having digital data has allowed governments to be more nimble in their health and economic responses, to pivot and respond to new data. And so I'm really interested in the panel today speaking about those opportunities that have been opened up. And I think we'll touch on how does that digital foundation allow you to speed up healthcare delivery and to improve quality? How do we think about the pressure that is on in terms of sharing of data and doing so securely so that governments have a holistic picture of their healthcare system, can be sharing it with their neighbors, and that citizens also have that holistic picture of their own healthcare? And what are the different policy steps that have been opened up and the pressures that COVID has exerted that will allow policy to keep step with the tech change that we're seeing? Thanks.
Great. Eyong?
Yeah, thanks, Akego. Look, I think it's a super exciting time to be in the healthcare sector in Africa. I think healthcare has never been as accessible, intelligent, or dynamic as it is today. There's still a lot to be done, but harnessing the opportunity that COVID has brought and focusing on some of the positive outcomes and changes that we need to do to make a significant fundamental change in rethinking all aspects of healthcare through the utilization of digital technologies, insights, and artificial intelligence is a phenomenal place to be operating today. So I think it's super exciting to be in healthcare today, and I think there's a lot we can do in record time.
Thank you. Penny?
Sure. Good morning, good afternoon, everybody. So I think COVID, as Anstice said, has provided us a window of opportunity. And one of the areas I've looked at and observed is really what I call the COVID catalyst. And this gives us some insights into what can be done and how we can change going forward. So not only technology, but access to healthcare, education, and all of these areas can help digital health and the wellness of everybody. So we've worked a lot in Africa, and every country is at a different stage, and we want to make digital health more accessible to both participants as well as their clinicians and other caregivers. So it's a very exciting time, and we're very fortunate to be part of this great initiative and going forward. Thank you.
Thank you. Mwai?
Thank you very much. I think for me, central to this discussion is access to better healthcare. I think we should move, and we are moving away from traditional ways of providing products and services. To me, this is in two ways, and I'm coming from a manufacturer's point of view, is we manufacture medicines. So it's the manufacture of medicines on one hand, and how we create or improve access for the patient. On the manufacturing side, I think really we should be leveraging technologies such as augmented reality and virtual reality to accelerate the technologies and the knowledge transfer, allowing for accelerated local manufacturing of products, which are quite complex and not yet very well developed here in the continent, so such as vaccines and biosimilars. On the other hand, on the patient side, there should be a really fully integrated platforms all the way from the manufacturers to the patient, and in between, obviously, having the pharmacists and the doctors increase the access of access of the medicines, but not just that, but also widen the scope into knowledge. So companies should start becoming knowledge leaders for the patients across the board and across the continent. And I'm looking forward to hearing a lot more about these things in this discussion. Thank you very much.
Thank you. And Roslyn?
Thank you so much for having me part of this panel. I've heard words that are music to my ears that I think everyone they have resonated with everyone, from digitalization, artificial intelligence, and access, right? And integration. These are all fundamental that we need now in healthcare. Healthcare is very global, but it's delivered locally. 25 years ago, I was a Peace Corps volunteer delivering those drops in the mouths of the under 2 children to get their polio in the mouth. So I understand the access and the integration that you need in the supply chain that was just discussed to get those medicines where they need to be. So I really look forward to this conversation to talk about how we can have the right policy environment and the right digital infrastructure environment to take the lessons learned from COVID, the lessons learned from Ebola, and the lessons learned globally to have a more healthy Africa and a more healthy economy, because we need our health to reopen our economy and to participate in all the opportunities that the digital world creates for the economic growth of Africa. So thank you so much.
Thank you so much. Thank you. Eyong, I'm just going to go, let's just dive right in, and I'm going to start with you. So COVID has accelerated digitization around the world, and these technological changes are disrupting industries and transforming jobs, at a faster rate than ever before. I wonder what your experience at GE Healthcare has been with the adoption of new technologies like AI, and what benefits they can bring to this skills gap that exists in the healthcare space in Africa.
Yeah, sure. Thanks, Akego. Look, I think with the increased use of advanced data analytics, connected devices, genomics, artificial intelligence, there's a real potential to drive some real breakthroughs in patient outcomes, and also bring enhanced operational efficiencies to healthcare providers with this data. Look, the challenge around the data is we've never produced as much data as we're producing today, but a lot of this data is actually not used and not implemented in regards to sharing the insights that the data holds potential to do, right? So what we need to see, and what we're starting to see, is how health systems can utilize artificial intelligence and analytics to utilizing the real-time data and actually converting this into actual improvements in resources, better patient outcomes, etc. And already we're seeing a number of these changes of how you turn raw data into actual outcomes and insights. And I'll touch on two areas, one focusing more on hospital efficiencies and the other one focusing on how you can bring AI into medical devices to support this. So the first one, where you're looking at medical or healthcare system management or hospital system management, is taking something like a command center. And the way I kind of visualize this is, the old movies of NASA, where you have these huge command centers with many screens and people are operating off those. You actually now have command centers where real life digital data is coming from the patient bedside into a central facility. And this facility could be within the hospital, or it could be remote anyway. And by utilizing, AI algorithms, you're able to get real-time resource management by focusing on the patient that is, where their vitals have changed. These can be picked up by running specific AI algorithms, so that you can actually focus and target the patients, the beds, the resources that are of greater need at that point in time. And this can all be done remotely, and you don't need to be at the bedside. So I think that kind of command center technology is really important. And at the moment within GE, over 200 hospitals worldwide are currently running this system. And we're looking to see how we can expand that into the Africa context. On the AI technology embedded into medical devices, this is again, COVID really helped kind of accelerate this. You have now medical devices that have got AI in it, or AI embedded into the software. And again, there's two examples I could share. One would be Critical Care Suite. This was the first FDA-approved AI algorithm that was embedded in mobile X-ray. And this is, having a significant impact in being able to identify and diagnose collapsed lung, as an example. Another one that I can talk about is the Thoracic Care Suite, and this was super important across countries like Nigeria, Uganda, Kenya, where you have, it's a partnership between GE and Lunet, which is a Korean tech startup, a healthcare tech startup. And they've been able to produce a system where you've got 8 different AI algorithms embedded into mobile X-ray, and that allows the identification of abnormalities linked to pneumonia, tuberculosis. And clearly that had a big impact in being able to diagnose patients with COVID when you had significant resource constraints during the pandemic peaks of the waves. So I think those are a couple of examples where we're already seeing AI embedded, be it in hospital infrastructure, be it in medical device and equipment, delivering true insights from that data that has been available for a number of years.
Thank you. And so are you seeing that, are those equipments being used on the continent? And is there any correlation between that and closing the skills gap that we have in the healthcare space?
Yeah, absolutely. So, the Thoracic Care Suite that I alluded to is standard and embedded in our mobile X-ray technology, and it's currently being deployed in, Uganda, Kenya, and Nigeria, to name a few. And so what that does enable, particularly in many of the sub-Saharan Africa countries where you have, huge constraints in regards to clinical capacity and access to actual physicians and healthcare, you're able to, run these systems within facilities. The insights are indicative and direct to a specific diagnosis, and they can be double checked at a hub, at a different location. So in the Nigeria context, you could hub in Lagos or Abuja, and these X-rays can be deployed in many states, and the data can be indicative of a positive test, which then can come back and get an opinion in real terms. So you don't have to have a radiographer, across all of the 36+1 states of Nigeria. You could have a radiographer in maybe 4, 5, 6, 10 states and be able to still give the insights that are needed, on the ground at the site where the patient is. So I think it's a huge.
Great, thank you so much, Ayong. Anses, I'm going to come to you now, just to talk about. We're here talking about data and the collection of. I'm delighted that we have representation from both Oracle and the Tony Blair Institute for this particular part of the conversation, because I want to look at how partnership and political will are drivers in the adoption of technology in the healthcare space in Africa. Maybe I'll actually go to Penny first, just because let's hear it from the Oracle point of view before we now come to talk about the government bit. So last year, Oracle and Tony Blair Institute announced a launch of a cloud-based health management system. So Penny, can you talk to us a little bit about the difference this cloud-based system has made in the healthcare industry and any challenges you faced and lessons learned from the rollout?
Great, well, thank you. So last year, as we were all learning more about COVID, we had lots of teams within Oracle saying, how can we help? And this pulled together a huge number of volunteers to help look at ways we could help with COVID. So it started mostly focused in the US around capabilities in the US, but that quickly transformed into what can we do worldwide. And one of the areas that we've have been working in is a joint partnership with Tony Blair Institute and other partners. And this is to look at how we could roll out our health management system to first aid in the vaccination effort and vaccine administration effort. So this was pulled together very quickly. We've been able to deploy it both for COVID and other vaccines for infectious disease in several countries in Africa. And part of the challenge of this was all the unknowns. There was no planning horizon. There was, when are vaccines going to show up? Which vaccines are going to show up? How many are going to be available? And the whole procurement process was disintermediated. It wasn't the typical cycle that people were used to being able to understand what vaccines would show up, but rather a plane will arrive at the airport and it will have vaccines on it, and they need to be quickly stored often and then distributed quickly for dissemination and administration to individuals. And then I also, as governments work through this, they're trying to sort out how do we communicate with our citizens, our residents. How do we plan all this? How do we get everybody trained? So a lot of the themes that have been touched on by Ayong and others, a lot of partnerships, so working together, bringing the best to help with these problems and challenges. Technology, cloud can make the system available across multiple areas, but there's also areas where there is not connectivity. So that's also challenging. But what the cloud solution does offer is aggregation of data. So there can be insights that people have mentioned that we can gain from having information together. Governments can use this information for better planning. Individuals and consumers can use that data on their own. They can own their health data. So all of these things can help adapt and change what we're seeing. And it's not just the technology or the digital health, as others have mentioned, it's accessibility to care. It's the training that's needed. It's the supplies that are needed, coordination with both governments and partners. So it takes a lot to move this forward. But this can really help with the initiatives. And we hope that this platform will also enable future insights, make use of future technologies, and apply all those as needed. So whether it's artificial intelligence, or whether it's insights and analytics, whether it's something as simple as proof of vaccination, working with other partners around those types of capabilities.
Fantastic, thank you. And just for the audience or people who are watching, if you do have any questions, we will have 10 minutes at the end to take your questions. So please put them in the chat, and we'll leave some time at the end to take them. Anses, coming to you now, the Institute provides government advisory work to leaders across sub-Saharan Africa. It is quite a unique position to have the ear of leaders. And I wonder what your experience has been with governments on rolling out this health data storage, and what impact you've seen at the Institute with the pilot countries so far.
Thanks. Yeah, we've really seen and partnered together with Oracle with leaders who, frankly, were already out in front and who often were driving digital transformation in their healthcare systems already. I mean, places like Ghana and Rwanda, but who not only had digital systems in place, but who recognized, again, this COVID imperative to be thinking bigger and to be thinking even outside of the healthcare sector. So really partnering with leaders from the head of state on down to their technical teams, working in ministries of health, but also ministries of ICT and tourism. So leadership that put their hands up and said, we've got systems in place, we're already using an EHR for our healthcare system, or we've already digitized HIV services, or we use DHIS2, but we know that the imperative for transparent, secure, shareable data is going to be bigger than just the healthcare system. There'll be cross-border sharing of data. There'll be the use of data to facilitate tourism and the reopening of economies. So I would say, in many ways, African leaders came to us and put their hands up to say, we get this bigger picture and reform-minded leadership. And then we really worked with not only the political leadership, but ensuring that we were working with teams who were ready to drive tech transformation. So who had a track record of tech transformation and recognizing that this was tech transformation, but often, as Penny noted, at speed and, with planes hitting the tarmac and a high level of public pressure and scrutiny on vaccine rollout. So technical teams who are willing to drive that and drive the training requirements, often virtually given COVID restrictions, to make that happen. And then also countries that had that track record of delivery on the immunization front. And then lastly, a real desire and ability to move the needle and be thinking outside of the box on what were quick policy reforms or policies to have in place around the protection of COVID data, around really sensitive personal health information. But again, keeping in mind the need for, in the long term, what we expect to see is interoperability and a sharing of standards amongst countries on how we share this data. So able to think really quickly in the near term as vaccines hit tarmacs, but with that bigger picture, I would say that's what drove the selection of countries where we're partnering. And in terms of impact, in the last really, 6 months, maybe a bit longer, we've again been designing and deploying this health management system at speed. And we've been able to pilot it first in Ghana, where they were running a nationwide yellow fever immunization campaign. So replacing the little yellow cards that people usually get with digitized data, one of the first cases where they digitized that data and moved it off of paper. In Rwanda, we were then digitizing the records for girls receiving HPV vaccines in schools. So again, taking away these paper-based logs at each school that a nurse would go through and fill out and making sure there was a digital record, and also making sure that digital record could be used for follow-up for the second dose. And we got some learnings there ahead of 2-dose vaccines for COVID. And then today, working with the system to digitize the COVID-19 rollout in Senegal. And again, that's an example where it's been deployment while the vaccines have been moving, while different manufacturers have arrived and changed how you record that data. So having a system that can move with that. And I think an example I quite like from the Senegal example is they did an open call for people to pre-register. And so people pre-registered digitally to note that they had a pre-existing condition or an underlying condition. That's not always obvious. You wouldn't necessarily see that pattern if you were just doing it on paper. And so for the first time, there was a digitized record and a sense of the population volume with those unreported and underlying conditions, all from going digital in that process. So it's been a learning curve. There's plenty more that we're learning in terms of the impact. I think a next step, again, is thinking about how those records are made available to individuals, to empower individuals to really use that digitized data, and then also thinking about the transfer across borders. And it's opened up a lot of conversations around what does a digital yellow card look like? COVID is what's in front of leaders today, but we've all lost that yellow fever card at the airport. It actually opens up a lot more that healthcare systems can do across borders and with the data that they're collecting.
Fantastic. Thank you so much for that. Rosalie, I'm going to come to you now. We've talked about the creation of digital records, the use of AI, and we've talked about just what do we do with all this data? And I guess the other issue now is data protection. There's the global rise in cybercrime, and Africa is not left out. And I wonder, from an IBM point of view, what can African countries do in their healthcare industry to protect themselves against these kinds of threats, as they continue to digitize?
Great question and great comments from everybody. We see security, you have to look at it in multiple layers, right? There's the security of the AI that Eyong was talking about, right? Is the AI trustworthy? Is the AI fair? Is the AI without bias? Is that AI secure? And there are nations that are already, like Brazil, like India, like Europe, that are looking at policies to make sure that the AI we use is trustworthy. So I think there's policy actions you can take there, such as requiring high-risk AIs to be tested for bias, tested for robustness of the data before it goes into use. And we see some laws around that. Then you have the infrastructure layer, right? How do we make sure that's secure? How do we make sure the pipes that the data is running through? How do we make sure the machines, where's the security in that? And there are other conversations at this event on 5G and that infrastructure. But one salient point is to make sure you're not reliant on any one choke point or any one vendor. Having redundancies and resiliencies built in will give you a layer of cybersecurity protection before you need it. But then, to your point, right, what about that actual data, that individual record, right, that Ants and her crew are digitizing, right? How do we protect that? There are now new ways, and especially if we're short on skills, right? You had mentioned that earlier. And AI can actually give you better security, right? So there's actually tooling to improve security that can be looked at, and lessons learned to make sure the digital infrastructure and those individual records you build are secure. But I would add that the WHO card, that yellow card, or any vaccination certificate, even if not digitized, is at risk. It's at risk for fraud. It's at risk for manipulation. And actually, if you digitize properly, you can build more security into your infrastructure when you run on trusted networks and you build a permissioned exchange to data. We've heard a little bit about it. You want interoperability so that different health systems within a country can talk to each other and different health systems globally can talk to each other. We need to be able to travel globally. So we need to make sure that a certificate that's issued to me in the United States, that says that I'm COVID-free, that I've either gotten the vaccine or I've tested negative, can work if I want to go to Kenya or if I want to go to the UK or if somebody from Germany wants to go. And there are people working on those standards for the airlines and making sure we recognize that, that if you have it and it's digitized, that it has not been tampered with. As you build those technologies, I would say and argue from IBM that you want to build it on open infrastructure so that you can have that interoperability. You're not reliant on any one vendor. Hopefully you like IBM, but if you don't, you can go to Oracle if we've all used the same technical standards. And that you have a permission trusted environment to exchange this data. And then we put policies on top of that. And you have a really good framework to do this digitalization safely and to build trust, not only in the technology, but also in the applications like AI.
Thank you, Rosalind. Why I'm going to come to you now. It's great to have an actual, pharmaceutical manufacturing company on the ground in Africa here with us today. Dawa Limited has about 11 countries and with over 100 product lines. What has been your experience with the use of technology, ICT, in delivering your products into the African market?
Thank you very much for that question. I think for us, what the most important thing is all about access to healthcare, right? And it's about access to the patient. And you can imagine we have a number of steps before it gets to the patient. And so how do we, if you like, bend that whole system and so that we can connect directly? So we do that in two ways. mostly in the operational way. And a lot of what we do is a combination of traditional tech and new era tech. So it's basically bringing together our CRM systems, our EPR systems, and connecting them to the distributors all the way to the pharmacist. So we are really, we have visibility in terms of things like stockouts, we have visibility in terms of usage, and therefore what we try to do is to ensure that our products, that the pharmacist has our products in stock, and therefore they don't have stockouts. Stockouts is one of the bigger problems within the continent. So that's one thing we do. Then the other part, I think, is more patient-centric, patient-connected. And so what we've done here is collaborated and integrated our systems with one or two mHealth, mobile health platforms, right? And so now this I think for me is where it becomes interesting, in the sense that we are now able to do a number of things. Number one, we're able to have a platform which brings the patients, medical practitioners, and caregivers into one platform. This really is mostly for knowledge, know-how. It's for know-how and for driving knowledge. Then the second thing that we do is we do runs, and not only that, we try to encourage patients who are not diagnosed into this platforms, which obviously helps with potential diagnosis, identify diseases, diabetes, high blood pressure, etc. And on top of that, help patients keep to their medication. So what we've now had to do, and what I think makes a lot of sense, is we've moved away from just simply being this regional company that operates in a number of African countries, 11, but also to be this company that is individual, right? So we using digital platforms, the mHealth platforms, going really down to the patient, understanding their needs, and then bringing functions are not ordinarily in that line into the process. So being almost like an educational platform, yet we are manufacturers. So that's how we've been using the digital tools as we try and bring access of healthcare to the patients.
That's fantastic. Thank you so much for that. I mean, COVID, I want to say as we come out of COVID, but on the continent, I'm not sure if we're going into a third or fourth wave as we work through COVID and try to move towards some sort of economic recovery. You know, it's very clear that technology is critical to our success. And so just looking at all that has happened over the past year or two, my next question is in two parts. Feel free to answer both or just one. What do you see as the biggest opportunities for growth in Africa as it relates to the use of technology in the healthcare space? And what kind of government policies do you think we need to have in place to support these opportunities? And who wants to go first? Should we just start as we went? Ayon, do you want to have a go?
Yeah, sure. Look, I think on the second part of the question in regards to government, this kind of healthcare development is an ecosystem play, right? There's no one company, no one institution, there's no one government that can solve this alone, right? So there's an importance to leverage the strengths of clinicians, technology partners, academics, to see how we can advance healthcare in that ecosystem. So what governments can do is definitely create an environment where innovation is encouraged, deliver some kind of fiscal stimuli to help drive organizations that are operating in that innovative space to see how they can work with that ecosystem, be it within the country, but also creating networks and environment around the rest of the continent, and then plugging into the global perspective, right, to see how you can better develop and innovate in that space. I think that's really important. Clearly, a big focus on the private sector in regards to SMEs is really key. The innovation comes from small companies. Yes, I run GE across Africa, but actually, where I see the innovation in GE is coming from our partnerships with startups and small companies that are much more nimble, much more faster, and are able to develop things in a much quicker. What we're able to do is bring them on board and take that concept to commercialization and then roll it out on a global platform. So that partnering with SMEs by multinationals, I think, is super important. And again, governments can continue to encourage that. PPP frameworks, so again, governments do not have the capex to invest in healthcare from a public perspective. And again, the way to grow that infrastructure is by working with the private sector. So having, strong, robust policy laws that govern how PPPs will operate and work, delivering innovative procurement models. So not just focusing on kind of old school procurement, which is the race to the bottom, and typically you lose quality and limits your ability to be creative by offering solutions. So looking at innovative procurement models and adapting the country's procurement laws, be it at a state level or at a national level, to encourage solution approaches to problems, I think is really important. Governments investing in the digital infrastructure, so rollout of fiber optic, again, is super important. There's over 800 million people that still are not connected to mobile internet across Africa. So, how can government support closing that gap? And last but not least, in funding and financing, so how do we get to affordable rates of interest? As an example, I'm based in Lagos, in Nigeria. The average commercial loan is 24 to 27%. That's just not the type of interest rates that small and medium-sized businesses can take on and become efficient and effective. Yes, there's cheaper money, but it's difficult to access. So I think if you look at that collectively, I think that's what governments can do, right? And I'll just briefly touch on if you can kind of get some of that right, and it's actually happening as we speak, then there's an explosion in African health tech startups, right, that are actually delivering real life and real time impact in the healthcare systems. A couple of examples. In Kenya, you've got Alara Health that's currently working, with robotics and AI technology to offer insights to hospitals. You've got Redbird in Ghana that's currently, working with pharmacies to see how they're able to deliver rapid tests at home for people that are suffering from chronic illnesses, And, the final example would be in Kenya, where you've got an organization like AfriRecord, who's, deploying a patient-centered medical e-platform that gives the data and the information to the patient versus the institution owning the data, right? So the patient is in control of his own data, and then he can take that from institution to institution so that whoever he meets in healthcare facilities, they have access to his patient records versus the old way, which is, you have to go to the facility to get your record. So I think there's an explosion in health tech startups that are actually delivering real value across the continent. I think, that enabling environment that I described will continue to power that.
Fantastic. Thank you so much. Penelope, can you just speak to the opportunities that you see in Africa in the healthcare space as far as tech is concerned?
Sure, thank you. So as Eyong mentioned, I think the ecosystem is really important. All these parts have to work together, and that will lead to more innovation. So some of the startups he just mentioned are doing some amazing things and putting things in the hands of the consumer and the individual. And I think that's going forward, that's going to be a common theme. From from a government point of view, there has to be longevity. These can't be initiatives that stop and start. They have to be sustained, and the infrastructure has to be put in place, both technical infrastructure, financial infrastructure, and access infrastructure. So that will also be really important to look forward for the impact to be realized. This is for the long haul. When Oracle started working in the vaccination space around COVID and some of the other infectious diseases, we offered this to African countries for 10 years through 2031. So it's not just around COVID, it's being offered as an option and a grant potentially for countries to take up. So we want to be in this for the long haul. We want to be able to have that impact over time and not just look at 2021, but look beyond that into the next decade. I think technology can bring a lot of wherewithal, and the innovation that we are seeing both by small organizations and startups that are nimble, that can bring the needs on the ground and the needs for that specific group immediate, right? They can see what the gaps are. They can look at solutions. So how do we work all together to be able to make that realistic and also be able to take those ideas and take them elsewhere too? So the coordination, it's across the whole continent. It's not just country by country. So I think there's going to be huge opportunities over the next several years, and we're going to see the benefits of that, but it's going to take a lot of hard work too.
Thank you. And Tess, do you want to talk to us about the kinds of government policies? I mean, you work a lot with governments across the continent. What kinds of policies do you encourage governments to look to support all these opportunities we've been talking about?
Yeah, I mean, I think what's complicated but exciting about policy in this space is that technology is a moving target. And so how do African governments design policies that can follow that moving target so that you don't have a policy written 5 years ago, legislated 2 years ago, that no longer keeps up with how a country is, for example, hosting their data. So one is, I think, as Ayang mentioned, that ability to have enabling environment that is about fostering innovation. And that's everything from doing business, how easy is it to open a business, but also how easy is it to run a business? And if I'm a startup, what sandbox policies are in place, for example, around fintech, which is an area that's moving quite quickly? Can I come to your country, pilot my startup, and then go somewhere else once I've done that learning? And so what are policies that foster that ability to start and start up and then to scale as well across borders? I think that's quite important. I think another issue around scale for the continent and the AU as a whole is thinking about cloud hosting and data sovereignty. How do you ensure that data sovereignty while also recognizing the imperatives around data sharing and doing that securely country by country? And so again, I think the Institute is thinking about how do we sit alongside governments in thinking about the next generation of cloud hosting, ensuring that data is secured, what's the highest possible security way that you can manage and secure your data. That can be on-prem, but it can also be on the cloud. And then thinking about what comes next. Again, tackling and taking really a coordinated approach across the AU to think about data sharing and cloud hosting and that major policy question that is in front of governments today. And I think the third area that's quite interesting is thinking about that interoperability piece and breaking down silos. I mean, we're talking about healthcare today, but if you establish a registry for vaccines, that same technology, if you think of it as a platform of platforms, can be plugging into your national digital ID, to your agriculture farmer registration system. Perhaps there's a subsidy system for farmer inputs, and you can be thinking about linking that. You can be taking data around solar home systems and the subsidy that users have, but feeding that back into a command center that's thinking about your health and economic response. So again, breaking down a lot of the silos that have been built between sectors and between the IT system that has been procured and built for each sector and for each ministry. I think that's huge. And I think the more you do that, it may sound quite small to think of procurement or think about getting data off of paper, but it unlocks more and more opportunity as you go. And it then lays the platform for big data so that something like telemedicine isn't just a doctor on the phone, but it's a doctor who has access to your digital records, or it is the ability to put together patient data with GIS data and start to do some AI and machine learning around loss to follow-up for vaccinations. Each of those are sequential steps, but I think if we think of a platform of platforms and linking these all in, then that is quite a huge force multiplier.
Thank you so much. Rosalind, what you briefly mentioned, working with the airlines for the, with the digital immunization cards, which I thought was very interesting. So it would be good to hear what opportunities you see coming out of this pandemic or as we move through this pandemic.
I think it goes back to some of the things we've heard and some things that I didn't quite hear in the policy discussion. One thing we needed when working with the airlines, or we work with the state of New York and we work with countries in Europe on their digital health passes, is that interoperability. And it's not for nations to create the standards, but it's for global groups. World Economic Forum has a common health pass, right? The WHO has technical standards on identity and the healthcare exchange of information. So let's use already identified technical standards that are open where they exist. So interoperability, I think, is going to be key to help us get out of this global pandemic, to make sure we all get out. And the issue that I haven't heard discussed, but it's underlying everything, is the equity issue. Mm-hmm. The reason why we want to digitize healthcare, I would think, is for better, more equal access. And the more data you have, the more you can verify, are these investments that Young talked about going to the right place. By digitizing the cancer registry in South Africa, you can make more informed policy decisions about mitigating cancer, where to invest in cancer, who is not being served. But you need that data to make those decisions. If not, you're just following money flows that have always existed, but might not be informed by the latest data and changes. So I wanted to bring in that equity to the conversation in setting policy. This is not just setting policy about technology, but setting policy to make sure the technology is used to help all. And to go back to your earlier comment about education. We heard a lot of great comments about the ecosystem. IBM also has many local partners. We couldn't do our business in Africa without great collaborations and partnerships with NGOs, with small businesses, with medium businesses, and with governments. And not only do we partner with them in commercial opportunities, but also on skills development, right? The more people that understand cybersecurity, the safer cybersecurity we'll have. And we have a free program, digitalnationafrica.org. You can go to and get a cybersecurity certificate, get an AI, and do job matching. But let me close on one word, is that a lot of African nations are doing a good job. They have data policies in place that are sound. Kenya has a good policy. South Africa has an old POPIA policy that they're looking at renewing. So I think that you can also pat yourself on the back of my colleagues here from Africa, that there are positive strides in these areas, and they are doing leading edge adoptions of these technologies. So we're on a right path. This conversation here is really heartwarming for me, as I said in the beginning, as we talk about digitization, equity, infrastructure, ecosystems. We're on the right path. Let's just keep going, working in this collaborative way. So thank you.
Thank you so much. Mwai, I'm coming to you last but not least. So what kind of opportunities are you seeing on the continent? And are there, we've heard about all the strides being made in Kenya, but you are in multiple countries. What kinds of policies do you think will help support your business as you grow on the continent? I wonder if he's having connectivity issues. Okay, I'm just going to, I know that we're pushing up against the last 10 minutes, and I'm just going to go to, we have a couple of questions. We probably can only take 2 questions right now, but I'm just going to read out the first question, and then I welcome everyone to, at least 1 or 2 people, to try and have a stab at it. This question is from Eckhard at the Director of Research and Evaluation at the University Research Company. And it says, there's a renewed emphasis globally on strengthening primary healthcare systems. How did the various initiatives discussed by the panelists address the challenge of connecting frontline healthcare providers to their platforms? I don't know if anybody wants to have a go at that.
Maybe I'll have a stab. Because I think GE is typically known for large scale, capital intensive radiology equipment, be it MRIs, CTs, X-rays, and the like. But actually, we have a big focus on primary healthcare and how we can deploy simple adaptive solutions that are able to be deployed where you have constraints, be it from a power perspective, and also have constraints from internet access perspective, where you can deploy and scale and essentially feed the hub of the spoke, right? And if you're able to build primary healthcare centers that have a basic range of equipment that are adapted to that environment, you're able to actually identify issues early, which is the reason why primary healthcare, you get the more bang for your buck by investing in primary healthcare. So prevention, as you know, is better than cure. Moving from sick care to healthcare is also super important as we look at the healthcare infrastructure. So how can you improve and strengthen primary healthcare, identify patients early, have them referred in early, and then you're clearly going to improve patient outcomes, but also help support or help save money, because acute care or specialist care is clearly far more expensive than primary healthcare. So look, I think there's a big focus on that, and the bit around the digitalization is that how do you then deploy basic technology that's connected to the hubs, so that you can get kind of real-time insights from hundreds of primary healthcare centers in the rural parts of the continent. So I think from a GE perspective, it's a big area for focus. We've done some great work, be it in Ethiopia, Ghana, Nigeria, Zambia, and it's an area that we're definitely focusing on supporting governments.
Fantastic. Mwai, I think are you back with us now? I know you're having connectivity challenges.
I am.
Maybe this question is one that you can tackle for us. It's from Chantal, and I'm not going to pronounce his last name, the CEO of Kukunda. And it says there's a huge shortage of oxygen as a result of the COVID-19 crisis. Is there any tech has been utilized to assist with the delivery of critical supplies like oxygen to better assist patients? I know that you've done a lot around COVID in Kenya. So do you want to speak to if you've used tech in that process?
Right. Okay. Thank you for that. So there are transferable experiences from our side. Obviously, we don't do oxygen, but ours is more of the medicines. I think what we've learned to do and what we are now implementing and ensuring we have in place is complete and horizontal integration across board, right? All the way from us manufacturers throughout to the patient. So I'll give you an example. And as I mentioned earlier, with our ERP systems, we are able to integrate our supply chain processes with those of our distributors, and then right through into the hospitals, the smaller hospitals, the pharmacies. And that way we're able to predict and we're able to see how quickly or how rapidly the medicines are being utilized and then draw down. And in that way, on our side, it helps us with our forecasting and then our manufacturing ramp up. So I think for us, that has been a powerful tool. It has helped our distributors, pharmacists, and at the end of the day, the patient, to ensure that we have the essential medicines at this time. So you can imagine things like vitamins, ascorbic acid, zinc, etc., products that ordinarily would not be running out are running out. And so that's how we've been able, the first 3 or 4 months we were seeing of last year, we're seeing sort of peaks and troughs of products. But now because of this integration, we have a much better way of predicting the usage and able to keep up with demand. So that's how I would propose it. As I said, we obviously don't manufacture oxygen, but I think integration for us is critically important.
Fantastic. Rosalind, did you want to add something to that?
Sure. It goes back to what I said earlier. Having more data can sometimes help set policies to help with crises, right? So the oxygen one is a good one. IBM has researchers all across the globe, including in Kenya and South Africa, where we have our Africa Research Lab. But this was with a partnership outside of Africa, where we've worked with academia and others to understand the acute respiratory syndrome associated with SARS and to understand the oxygen needs and to do research on best ways and how much ventilation one needs. Shortened ventilators can limit lung damage while freeing up other machines. And so we used AI to model all of this and to make more informed decisions on which ventilators to use, how to use ventilators. And I'm sure we've all heard about the sharing of ventilators or repurposing other medical devices to serve as ventilators. So all of this, we can make better, the doctor can make a better decision if they have the data and the information. So we've donated high performance computing and research capabilities to in this effort, and I think that there's been some progress. It's not the best solution. We still need more ventilators, but at least with effective data, you can make better decisions.
That's fantastic. Data is king. That's the sum total of this. Data is king. We're going to have to leave it here for now. Thank you to all our speakers, to our guests, and to the U.S. Trade and Development Agency for organizing this workshop. I just want to quickly add that the 13th U.S. Africa Business Summit starts tomorrow, and we will have 5 sessions dedicated to health. Registration remains open, and we welcome you to join us. Thank you once again. Stay safe and have a lovely day.